Good day, everyone. My group comprised three people myself, Jhon, Mark, and Agapito. For this session, we will be dissecting a pig's kidney, locate its major structure, and trace the fat taken through the kidney by blood and the filtrate that becomes the urine. The renal artery carries a large amount of blood from the aorta to the kidney. This is the renal vein, the main blood vessel that carries blood from the kidney and ureter to the inferior vena cava, a large vein that carries blood to the heart from the lower part of the body. This is the renal cortex. It is the solid-looking outermost part of the kidney. It contains many small arteries and veins that carry blood to and from nephrons. Located in the cortex, in this is the medulla. It is the region located inward from the cortex. It includes the cone-shaped renal pyramids. These are the fibrous or strip triangular zone in the medulla that contain the collecting ducts which collect urine from the kidney. Two balls of the nephrons in the cortex between the pyramids are the renal columns that contain middle-sized arteries and veins that carry blood between the nephrons in the cortex and the renal artery. In vein, the hollow area in the center of the renal artery. In vein, the hollow area in the center of the kidney is the renal pelvis. From there, the urine passes out through the ureter to the urinary bladder. Unfiltered blood enters the kidney through the renal arteries and found in the hyaluronic region. It branches off into the segmental arteries and then it will get along the space between the renal pyramids known as the renal columns. These blood vessels are known as the interblare arteries, after which it will split off into the top of or the base of the renal pyramids known as the arterial arteries. Then it will further branch into the renal cortex as the interblare arteries are cortical radii arteries. These blood vessels serve multiple nephrons where filtrate of the blood occurs, especially in the glomerulus vein of the afferent arteries. Once the waves are filtered, blood exceeds to the afferent arteries and the diverge into particular which supply bloodstream proximal in the cell, convoluted tubules, and into the versecta, which supplies blood to the loop of vein. It will converge again in the cortical radiate veins or interbular veins. Then it passes through the arterial veins at the base of the pyramids. This leads to the blood back, the renal columns, and the interlobal veins, which then goes to renal veins in the hyaline region before sending the filtered blood to the inferior vena cava of the heart. The glomerular filtration, which happens in the renal cortex, in the origin of filtrate comes from the water and smaller solids. First to the capillary walls of the blood vessels and glomerular capsules, first to the renal tube, second tubular absorption, which happens the moment when the filtrate for, from the moment capsule enters the proximal convoluted tubule. This happens again in the renal cortex. Useful substance in the filtrate or transform it out in the tubule and then returning to bloodstream to the adjacent capillaries. Majority of water reabsorption happens in the proximal convoluted tubule of the cortex. Lastly, we have the tubular secretion. Hydrogen and potassium ions creating means in the drugs are further removed from particular blood and secreted by tubule cells in the filtrate. These secreted ions plus the filtrate form the urine. The urine then flows out of nephron tubule into the collecting duct, passing through the renal pelvis into the ureter, and then it will gonna go down the urinary bladder. So that includes the pathway of the filtrate of the urine.